Here are 3 spots you should feel pain if you have a torn ACL. The number 1 spot is going to be deep in the knee. So behind the kneecap, deeper than that, deep inside the knee joint. Not quite the back, not quite the front, but in the middle of the knee joint, because that's exactly where the ACL is located. People will say it hurts deep in the knee. That's going to be the most common spot. The second most common spot is going to be on the back side of the knee, in the bend of the knee. The reason for that is because when there's swelling that's associated with the injury to the ACL, the back part of the knee is the most vulnerable to accumulating swelling. So you might even get puffy back there. That's very common. And with the swelling can come a loss of motion, especially not being able to bend it. So people will say they have pain deep in the knee, number 1, and then the back of the knee and the bend of the knee right here. And then the third part's going to be on the sides of the knee, kind of all around the sides. Now, I know you might be saying, well, the whole knee hurts, but let me share more. Just follow me here. At the knee joint, where it bends, that's the location of the ACL. The ACL is connecting the top bone, the thigh bone right here, the femur, to the shin bone, the tibia. And so the ACL is inside the joint. So it is possible to feel pain all around the sides, the back, and the front behind the kneecap as well. But where you don't typically have a lot of pain, it can happen, is above that or below that. Now, if the problem has been there for a while and your knee is swollen, like the swelling has been there for days or even weeks, then you do get pain that starts to spread to other areas. It is possible to get pain that goes down into the calf area, into the front of the leg, because you have 3 big nerves that all pass through the knee joints, around the knee joints. And if the swelling's present there, that swelling can press on those nerves and cause pain to shoot down into the foot. There's a saphenous nerve on the inside of the leg here, the tibial nerve is right in the back of the calf, and then you have the fibular nerve that covers this outside and the front of the leg, and all these nerves go down into the foot as well, so people can get foot pain, even pain in their toes. The muscles that are on the front of the thigh, especially the quads, sometimes those start to lock up, they seize up, and so it is possible to also have pain right above the kneecap, all the way up to the front of your hip. And if the problem's been there for a while and you're not walking normal because your knee hurts, then you might start getting back pain, or possibly even your other leg starts to hurt because you're putting more pressure on it, or you're limping, you're walking funny, so other things begin to hurt. But initially, when you first have an ACL tear, it's going to be deep in the knee, then the back of the knee as it goes on longer because more swelling starting to happen, and then the sides of the knee as it goes even longer, and then after that it spreads to the lower leg, the foot, the hip, the thigh, the back, and the other leg. I hope this helps you out, friends. If you want to learn more about how to help an ACL tear naturally heal so that you can avoid an ACL reconstruction surgery, I've got tons of videos that guide you on the process and answer a bunch of questions on how to heal your ACL, linked into a playlist called the ACL Tear Help Playlist. You can find that in the description below. There's a link to that in the description below. I've also got a program that I've put my whole treatment approach, because I'm a specialist. I help people naturally heal from problems like this and avoid surgery. So I've got my whole treatment approach. It's called the ACL Tear Recovery Program. There's a link for you to learn more about it in the description below as well. If this video helped you out, please give us a thumbs up. Drop a comment if you have any questions, or if you just want to tell us your story. We'd love to see that. We'd love to get back to our comments too. And then also share this with a friend. If you have a friend that is suffering from an ACL problem, they need to know this. Share that playlist with them as well. And please subscribe to our channel and turn on our notification bell so that you don't miss out on any of the helpful videos we post each and every week. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.